Hi guys, it's Jasmine. In this section, I'm going to be explaining the pre-care before your lip tattoo. So every single artist will have slightly different pre-care depending on the artist and their personal preference. But as a whole, we need to follow some steps in order to get the perfect heel from your lip tattoo. So I'm going to talk about what I think is very important before your lip tattoo, what to do and what not to do. So before your lip tattoo, we must ensure that the lips are healthy, as the skin is the canvas in which we're going to be applying pigment into the lip. So if the lip is compromised, i.e. if you have a cut, a spot, if you've got very chapped lips, you're not going to get the perfect heel for your lip tattoo. So it is super important to have a really good healthy canvas before you get your lip tattooing done. So I highly advise moisturizing your lips, using a really good moisturizing lip balm before the tattoo. I would say for at least a week before, every day keep applying the lip balm. A really good lip balm that I recommend is the 8-Hour Intensive Repair by Elizabeth Arden in the small pot. I'll show a picture here so you can see. This is a really good intensive lip moisturizer. Apply it a few times a day and you'll get a really nice soft lip. Also exfoliate the lip. This is really important, is if you have any chapped lip, especially in the inner bottom part of the lip, this is really going to influence how the needle goes into the skin. It's basically going to bounce off the skin and we're not going to get any colour implantation. So really make sure that you have no dead skin on your lip. Exfoliate before. You can use any exfoliation. I would say give it at least 3 days before. Try not to exfoliate on the day, just in case you cause any irritation to the lip. So give it at least 3 days before, exfoliate and moisturize. That is the most important tip I could give you. We also need to bear in mind just general pre-care, which would be for all tattoo treatments, but especially for lips. No blood thinners, no ibuprofen or aspirin. As well, alcohol. These are all blood thinners. So if you have a really heavy night the night before, if you get really drunk, not a good idea to get the lip tattoo the day after, because that alcohol is still going to be in your system. Therefore, when we cut the skin, you are going to bleed. In turn, that means you're not going to get a lot of pigment retention, because that blood is going to push the pigment out. So that goes for any blood thinners. If you're on any medication, you need to talk to your doctor before stopping any medication. Big things like warfarin, big blood thinners, definitely not going to be able to have the treatment. So keep all of that at bay. I would say at least 48 hours, no blood thinners. And then if you're on any strong medication, you have to consult your doctor first. Also pre-care, we have to think about the surrounding skin. So if you have any strong skincare, retinols, AHAs, chemical peels, microdermabrasion, you need to keep these treatments away from the lip area. And I would avoid having your PMU done at least a week after these strong treatments. And even longer is a bit better, but that would be the absolute soonest, because again, these are going to thin the skin, therefore we may be a little bit sensitive around the lip area. Also, we need to think about your laser and any waxing and threading. If you have had waxing the week before or a few days before the lip tattoo, if a little bit of skin has been taken off and then we tattoo the lips, the pigment tends to go a little bit around during the treatment, so we can push that pigment into the cup, and then you'll have a little graze with a bit of pigment in, which is obviously you don't want to have that. So I would give it again a week before. Avoid laser, IPL, waxing, threading around the area of the lips. If you have any cold sore virus or herpes simplex virus in your system, if you've ever had a cold sore in your whole entire life, even if you was a child, you need to get some medication to prevent outbreaks of this virus. It's called acyclovir or Zovirax. Acyclovir is a tablet form, Zovirax is a topical form. Because what happens is, if you have the cold sore virus in your system, it lays dormant in the nerve cells. If we go in with the tattoo, we can stimulate an outbreak by the trauma of the needle. We have not given you a cold sore. It's got nothing to do with the treatment. It's all sterile and completely clean during the treatment, but the tattoo trauma can stimulate an outbreak if you have the virus in your system. So usually you would know if you have the cold sore virus, if you're a little bit stressed out, if you go in the sun, the UV can cause an outbreak, as well as trauma needles. So you must get that medication before. If you don't, you are high risk of an outbreak. Usually it's on day 3 of the healing process. Best to take it before, like a week before, prep the lips and the skin with the medication, and then use it for a week's course. Worst case scenario, take it on the day, but obviously the later you leave it, the more susceptible you are to an outbreak. It isn't the end of the world. You can, you know, ride it out, but it's just not going to be a very nice healing process for you. And lastly, I want to talk about fillers and injections around the area of the lip. It's absolutely fine to have lip fillers and have the permanent makeup. You need to make sure that if you're getting the fillers and the PMU, they have to be 4 weeks in between each treatment. So you can have the fillers, 4 weeks later you can have the PMU, and vice versa. If the filler is very migrated, that is a little bit of a different story, because if the filler's migrated and very overfilled, we're never going to get a flattering shape because of the filler, and the skin may be resistant. So we may ask you to get the lips dissolved and then refilled before any PMU treatment. But you know, if they're filled nicely, it does tend to stretch out any lines that are in the lip. So if you do have very wrinkled lips, I do actually recommend getting a little bit of filler just to push the lines out, not for volume, but just to push the lines out and give us a smooth canvas to work on. So just bear that in mind. You need to make sure that you give it at least 4 weeks before any filler treatment, as well as sort of injections around the area. If you're having sort of Botox around the area, again, give it 4 weeks just to allow the Botox to kick in and sink. If you're having any top-up treatments of the Botox, I'd recommend getting that completely finished before coming to us for any treatment. And just a disclaimer, I'm not saying everyone needs to get filler or Botox to get good treatment. This just can enhance the treatment if you're looking into these sort of treatment plans for yourself. And also a bit of pre-advice, it is good to have an idea of what you want to achieve with the permanent makeup. A lot of my clients bring in their favourite lipstick, or they might show us some pictures on the lead up. So have a little think about what you want to achieve, where you want to go with the treatment. Also, it depends on your lip, and obviously the shape, your age will depend on what we recommend for you. But permanent makeup is for a very, very wide range of people, and we work with lots of different clients from all ethnic backgrounds. So having an understanding of where you want to go is really good on the lead up to your treatment. Thank you for watching. I'm Jasmine, and I'll see you in the next video.